So I want to say thanks for your interest in looking at our program here. I am the program director for the Infectious Disease Fellowship here at West Virginia University in Morgantown. And we have a lot of cool, exciting things happening in the upcoming year for our program. We are one of only 11 programs selected by the CDC to have a joint ID-EIS fellowship program, which means you would get to match into our program and have a guaranteed EIS spot with the CDC afterwards. Second, we have a combined infectious disease and critical care track where, in addition to matching into our fellowship, if you have an interest in critical care, you would automatically match into that third year in our critical care program. And the other thing that's really cool here and that I'm passionate about is global health. I travel abroad 3 times a year, precepting students, residents, and fellows. And we do have a global health concentration within our fellowship that allows for an international elective for those fellows who have that interest. Outside of that, our program is one that is very clinical focused. We have a lot of diverse pathology as an area that serves both Pennsylvania, West Virginia, Maryland, Ohio. As you can imagine, here in Appalachia, we have a lot of substance abuse and infections related to that. So we see our fair share of hepatitis A, B, C, in addition to rising HIV rates. So your HIV experience will be robust here, in addition to your other infections among substance users. Within West Virginia, as we continue to expand here across our state, the other aspect that we look to do is infectious disease consultations at our other sister hospitals. Our fellows get the experience of doing inpatient telehealth video consults in addition to their outpatient, and so we look to expand that access to ID care throughout our state. The other thing that we're hoping to increase in our fellowship is our transplant experience. We do now do both kidneys and hearts in addition to our robust bone marrow transplant. So we are looking for additional electives in immunocompromised populations for those fellows who have that interest. So within our fellowship, what we look for is really who's going to link well with our colleagues. We are a close-knit group. We only have 9 core faculty, and we have 4 fellows, 2 each year. So it's a smaller group. We hang out all the time. All of our offices are on the same floor, so we see each other a lot. So we're really looking for that fellow who wants to engage with their colleagues. We're looking for those fellows who like to experience life together and not just doing the work together. We have social events and wellness events every month. Our fellows get 6 days off every single month so they can hang out with their families or hang out with us for even more time. The second thing I'm looking for is this is a state that has unfortunately had limited access to care in the past, and we face a lot of difficulties here among our patients in terms of getting to care or staying in care. And so I am looking for those fellows who want to work with that patient population. And so there is a lot of stigma here, so we're hoping for fellows who want to engage, want to help, and want to succeed here. In addition to the clinical care that we have here, we do have an opportunity for our fellows to engage in research. We have the Clinical Translational Science Institute right here on campus, which is spearheaded by a fellow ID colleague, Dr. Hodder, where our fellows have the opportunity during their first year to complete a Fellows Research Academy, which is a 12-month program where they learn how to not only develop protocols and study designs, but they learn how to write grants, which can be successful for the future. In addition, there are fellows who get funded to do their project that second year if it's one of the top projects chosen. And so even if you come into this program not having research experience, we make sure we get that to you up to that first year and then continue on into your second year. I did my undergrad here, my medical school here, my residency here. I did leave for about 8 years and came back in 2019 because I missed this town. This is a university town that has all of the trappings of big cities. So we do have, food, nice food places. We have cultural events. There's concerts. There's plays. Again, because the university is here. In addition, we are literally minutes away from being up in the mountains, and so there's a lot of outdoor activity. I myself do a lot of running on the rail trail. Some of my fellows like to do pickleball or go hiking together. We go out boating on Cheat Lake, and so the outdoor activities here in Morgantown make it a little bit unique in the sense that yes, you're within a city, but you can easily escape outside on your weekends off or your evenings off. Other strengths of our program is that we have a really strong pharmacy program here with ID. We have 6 ID trained pharmacists who work with our OPAT program and our antimicrobial stewardship program. So that allows our fellows to not only have experience in antimicrobial stewardship and OPAT, but it takes a lot of the burden of that work off of us as we continue to do our consultations. In addition, that allows for a lot of research collaboration among our pharmacy colleagues. And second to that, we also have our own hospital epidemiologist here who covers all the hospitals in our system, but he also allows for our fellows to engage in hospital epi work if they have that interest. So they can leave here not just being a really well clinically trained ID doctor, but if their focus wants to be antimicrobial stewardship or infection control, we have that flexibility to make sure that's their process. So I'm really excited that you've checked out our program. Please reach out to the contact information if you have any further questions. We're always willing to reach out and answer those questions ahead of time. And just know that if you come here, you're going to be at a well-supported fellowship that is fellow-driven, and we would love to have you.